let's talk about insurance companies and how they are dealt with in a concierge practice.
Sure. There's different models of concierge practice. In my particular one, we allow the patient to, continue with their insurance, whatever that is, whether it's commercial, Blue Cross, whatever. But we joke about it. That executive exam that's so high-powered, where we budget out at least 90 minutes for your debrief. A
debrief is their initial exam?
Yes. You spend an hour in the initial period, and then there's about a 2-week gap where we get the information in, and then I sift through that and come up with a game plan, and then I do a 90-minute debrief with you. So that's the thing that's in the top 5, 6 in the country. But we joke about it. We say, your insurance company doesn't even know you're in the building because the handcuffs are off. I think Dr. Perlmutter said this very well. Insurance will put handcuffs on us as physicians and you as patients, because quite honestly, with certain preventive care, they're good. Immunizations, we'll talk about that a little later. Immunizations, they're good. For ladies, pap smears, mammograms at appropriate times, bone densities. They're trying to hit some of those hot topics, those things that are needed. But the big gap, and it's been this way for over the 20 years that MDVIP's been in existence, and they saw this in the early years, and it's this: cardiovascular death, folks. As bad as COVID is, as bad as cancer is, cardiovascular death has reigned supreme in terms of causes of death in this country. And if it's going to take you out early, it's generally going to be cardiovascular. And so the big gap in insurance coverage is they don't cover that well. So it's like, if there's a ticking noise in that corner over there, we're all going to get a little nervous because we're going to say, hey, Sandra, should you check that thing over there? It might be a bomb ready to go off, right? Well, insurance, I hate to say it, in some regards with cardiovascular, they'd rather have the bomb go off and then they'll pay to
respond to the explosion.
They'll pay to piece you together again as best they can. My view in MDVIP and my concierge practice is, if we hear the ticking noise, let's go after that. And how are you going to know if it's ticking? If you cannot detect a problem before it becomes symptomatic, you won't know it exists until you have your stroke, until you have your heart attack. And what we're finding now is that age doesn't protect you necessarily. We live in a society where things are different than they used to be. I found plaque as early as age 26.
Plaque meaning the material that blocks a blood vessel.
Wow.
And it will continue unabated to grow unless you know you have an issue. If you have an issue, then at least we can outline some ways to keep that plaque from growing.
So just to regress a second, plaque is the material that lines the inside of blood vessels that make them narrower, that can give you a heart attack if it's in your coronary arteries, or that plaque can break free and your carotid arteries go into your brain and block blood flow and give you a stroke.
Correct.
So
Bad
plaque is an
stuff.
important issue.
Yeah, it really is.
Right.
Yeah,
And discovering it
26.
early.
At 26 years old, you found?
26 is the youngest I've detected it. Lots of people in their mid-30s.
So she has a family disease, right?
Oh.
She has a genetically based disease, and so you can take that information, go to the insurance company and say, hey, we have a family member who's predisposed to dying early from a disease. I'd like to work up the rest of the family, but since there's been no even ticking heard in that bomb, often the care is denied.
Yeah. Yeah. So, and I've engaged a world-class expert who has the instruments and the training to be able to do this type of testing, negotiated a fee lower than he would normally charge. So, what we're trying to do is to help people to find out what is your health right now, and no matter where you are when you walk into our practice, we're trying to find you on a better path to a better health. And that road is different for different people. Mm-hmm. It's filled with ups and downs, but we're there with you. And as I tell patients who come in for a meet and greet, you're stuck with me. There's no PAs, there's no nurse practitioners. So I'm the guy that you know, one of the scariest things about this, they have my contact information. They can get me.
Right.
And I know you're very good about that.
Every patient gets our cell phone, right?
But we're unique.
Right.
You know, and in this day and age. And honestly, the patients respect that, but you have a point of contact. So, you know, it's an amazing, it's a freeing up thing for a patient, honestly.
It is. I mean, I can in 25 years, before there were cell phones, there were beepers, and in 25 years, I can count on one hand the number of times I've regretted sharing my personal contact information with somebody. I can count thousands of times it saved my butt, right? Because a dressing was too tight, or they had a complication with a medicine, and if I can head that off with a telephone call and save them a 6-hour trip to an emergency room, or they don't contact me at all and they think that a small problem to them, which could be a huge problem to me, if we don't address that, there's a problem, right? So direct and intimate communication with a patient is super critical for quality care.
Absolutely.
And we both have done that from the beginning.
Yeah.
So a third thing we have in common.